Let's talk about the Medicare Advantage. We're going to talk about the 2024 MA final rule, which came out in 2023 and then implemented January 1 of 2024. So this particular rule changed a lot of internal processes at Medicare Advantage organizations. And this included both their prior authorization programs, but also their utilization review. And when the rule came out, it really had parts that were brand new requirements. And then it had parts that were clarification of long-standing requirements that Medicare Advantage organizations had already been complying with for years. And we expected the new requirements to be work. Like anytime you have new requirements that come out from CMS, you've got to change processes. You've got to figure out how to comply with those. But what we discovered is that there was just as much work to be done with those parts of the rule that were the clarification of these longstanding regulations. That happened because prior to this final rule, there really was a disconnect out there as to which policies and procedures Medicare Advantage organizations needed to follow and which ones they didn't need to follow. So it was pretty clear, there was pretty general consensus that you needed to follow clinical policies. And clinical policies are usually defined as local coverage determinations, national coverage determinations. But that's just like a drop in the bucket of the Medicare regulations that are out there. And so the rest of those regulations are things like billing rules that might also impact when a benefit category begins. So a good example of that is the 2-midnight rule. The 2-midnight rule is really a billing rule. It's not a clinical rule. It's a payment rule. But it establishes kind of the boundary of when something should be paid as an inpatient and when something should be paid as an outpatient. So prior to the 2024 rule coming out, there was this disconnect because it's not a clinical rule, and MA plans have kind of some leadways on which billing and coding kind of policies they have to follow. They also have flexibility around how they do payments and some other structures. And so in general, they weren't following that rule. They may not be following that rule because it wasn't as clear if they needed to follow it or not. And so with this new final rule and this clarification that came out from CMS, they really defined this whole swath of Medicare regulations that are now definitely included that Medicare Advantage programs need to follow that maybe they didn't need to in the past. And so that has really changed processes in prior authorization and utilization review. Those of us who work in regulatory, who work in compliance, like when you get a new set of regulations, you try to approach it from like, what is CMS trying to tell me? Like you try to be in like this neutral space about what this policy means. But that's really difficult to do because you have regulatory people on the payer side, you have regulatory people on the provider side. And so it's difficult not to look at that regulation through the lens of what does this mean to me as a payer and what does this mean to me as a provider? And so it's not uncommon for federal regulations for there to be quite a bit of variation in like what is CMS's intent, especially before additional sub-regulatory guidance comes out. And I think this is one of those places where we had that situation. Like there was some guidance. It wasn't 100% clear. It was interpreted differently depending on where in the market space you were. And so now getting everybody back onto the same page with this subsequent rule is going to be the challenge in 2024.